It's always a pleasure for me to welcome today's moderator to this event, Dean Lynn Goldman. Lynn Goldman is the Michael and Laurie Milken Dean of Milken Institute School of Public Health at the George Washington University. Before joining Milken Institute in 2010, she was a professor of environmental health sciences at Johns Hopkins University's Bloomberg School of Public Health. Prior to that, Dean Goldman served as assistant administrator to the EPA's Office of Chemical Safety and Pollution Prevention, where she was responsible for national implementation of chemical and pesticide safety and pollution prevention laws. She also worked at the California Department of Public Health, where she headed the Division of Environmental and Occupational Disease Control. Dr. Goldman serves on the board of the Environmental Defense Fund and is a member of both the Institute of Medicine, where she also serves as a member of the Governing Council, and the National Academy of Sciences Board of Environmental Sciences and Toxicology. In 2013, Dean Goldman received an honorary doctorate from, is it Örebro? How do you pronounce it? Örebro, thank you, University in Sweden, for her contribution to chemical legislation in the U.S. and Sweden, and her influence on the research conducted by the University of Man-Technology Environmental Research Center. She holds a B.S. in conservation of natural resources and an MS in health and medical sciences from the University of California, Berkeley, and an MPH from Johns Hopkins University, and an MD from the University of California, San Francisco. Lynn?
Thank you, Tom.
Thank you.
Before I introduce our panel, I need to give my personal thanks to Dr. Birnbaum for such a wonderful kind of a romp through the whole field of environmental health in children, and particularly the fabulous work that is going on at the NIEHS. I think that Dr. Birnbaum is an example of the important role that leadership can play in the government. She's been a passionate advocate for not only the protection of the environment and for public health, but also for children specifically. And I think it's clear that she's making an enormous difference. Thank you so much, Linda. That was wonderful. So we're going to have a panel that's going to have a discussion here. And the way we're going to do this is that we're going to hear a little bit from each panelist. Going to have a little bit of time to have a discussion among the members of the panel, and then we're going to include the audience in that process. But I think it's obvious from what you've just heard from Dr. Birnbaum that we're in a truly exciting era in the field of not only environmental hazards to children, but really biomedical science writ large. The exploding knowledge in areas like epigenetics, our understanding of the interplay between our exposures, environmental exposures, our genetics, our epigenetics, hormonal signaling of all kinds, and the microbiome, which she slightly mentioned. It's not only that we're beginning to understand much more about health and disease, we're just beginning to understand what we really are as human beings. And a major part of that has to do with understanding what's going on with children, because children are not only important in and of themselves, and I would say that they're extremely important in and of themselves, but they're also important because of what they become and because of the fact that so many health hazards are imprinted in them over their lifetimes, as you heard from Dr. Birnbaum. And our three speakers are very prepared to tell us about some of the aspects of that. Dr. Birnbaum already mentioned the importance of the people who work to help us to understand these huge volumes of data that we now can produce. And we have as our first panelist, Jonathan Cohen, who in fact is an expert of that. Dr. Cohen is technical director at ICF, where he has 33 years of experience in statistics and data analysis. He has a PhD from Imperial College in London with an emphasis on the areas of applied probability and statistical aspects of extreme value theory. He has been a professor in various institutions, but he has actually been at ICF for 26 years, where he manages a wide variety of projects for the government and commercial clients. It's particularly projects that involve the application of statistical data analysis to environmental, land, air, water, and emissions data. We also have with us Ami Sota, who is an assistant professor in our Department of Environmental and Occupational Health at the Milken Institute School of Public Health. Dr. Zota is an environmental epidemiologist, and her interest is in formulating hypotheses and studies that will help us to unravel how some of these very complex issues related to not only environmental exposures but also social disadvantage and in terms of disparities in reproductive and children's health across the life course, as well as pathways that might lead to ways to prevent some of these adverse outcomes. Her research has been featured in the Washington Post, Time Magazine, the Atlantic Monthly, and so forth. She currently has a K99R00 Career Development Award from the National Institute of Environmental Health Sciences, for which we thank Dr. Birnbaum. Thank you very much for that. And under this grant, she is developing conceptual and methodological frameworks for examining the independent and potentially synergistic effects of endocrine disrupting chemicals and psychosocial stress on perinatal outcomes. Our third speaker, Dr. Rebecca Clifton, is Associate Research Professor of Epidemiology and Biostatistics, also at the Milken Institute School of Public Health, but also at the university's Biostatistics Center, which she joined in 1997. Dr. Clifton has been a principal and co-investigator on a number of very large multi-center and multi-cohort collaborative studies. Her research interests include gestational weight gain, preeclampsia, preterm birth, and the impact of intrauterine environment on child health. She has served as a grant reviewer for multiple NIH institutes, as well as obstetric and obstetrical journals.